Greetings and welcome to Diabetic Health Clinic. This is the coronavirus COVID-19 update. What we thought we'd do is we would share with you some of the information about coronavirus or COVID-19 and type 2 diabetes. We've all heard that type 2 diabetics are at a greater risk, so we'd like to unpack that and give you some information around that. What we're faced with right now is an absolutely terrible situation. I myself don't remember anything like this. We've had pandemics before, but this has actually closed the world down. It is almost hard to imagine. So far, many people have died and many more are predicted to die. That's the problem. It has also caused worldwide economy difficulties. We've seen the stock market crash. We have seen economies virtually stop because of lockdowns. People are obviously right now worried about their jobs and also their income. We are also restricted as to where we can go and how we can move around. All of this leads to a lot of uncertainty, and people are just simply uncertain about what the future holds. There is also, in association with that, a lot of panic buying. I mean, we've seen things like toilet paper disappear worldwide virtually. We have also seen things like rice disappear, tinned goods. These are all things that people are stocking up on just in case. People are becoming very, very scared. We are in a period of time where people are on the edge. When we look at the situation, it actually looks relentless. This COVID-19 or coronavirus appears to be coming to get the whole world, and there is a lot of questions around the coronavirus at the moment. It's actually become a worldwide problem right around the whole globe. Virtually no one is immune from this problem, and the panic buttons have been hit. The panic buttons have been hit by people and governments right across the globe. So the question is, why do we have this panic? Well, first of all, the reality is it is a new virus. So we actually don't know a lot about this virus. We're learning slowly, but there's still a lot to go. Governments are now tightening up on people moving around. I mean, that in itself is causing panic. Imagine trying to get home to a country and there's no flights. The flights are being cancelled because governments are saying, no, you can't travel. So as the passenger numbers drop, everything gets so much harder. Governments are trying to restrict being exposed to others that may potentially be a carrier of the virus and infect you. Governments really don't know much about the virus, but they are doing the best to protect us. That is the reality of the situation that we are in. The question now is, why the isolation? Why is that such a big deal? Well, this virus appears to be very contagious. It spreads easily and very quickly. The reality is that as this virus infects people around the globe and in different countries, there is a small percentage of people that will get very ill. Very ill generally happens in older populations, especially when there are underlying issues like, for example, heart disease, diabetes, or respiratory problems. The reality is this, that if everyone is infected at the same time, the small percentage of very ill people will overfill our intensive care wards and people will die. There will simply not be enough beds for people. We are really in a situation where right across the globe, we're saying help, do something, help. Then on top of that, there is all this social media propaganda. And look, I'm sure that you've seen some of this. A lot of it is very misleading. So it's very important to understand that what you see on social media may actually not be very helpful for you. You've got to make sure that it comes from a credible source. A credible source that we can rely on at the moment is the government. The government, at least here in Australia, are doing a fantastic job. They are advising us, at least on a daily basis, sometimes a couple of times a day, with information, new information. They're giving us updates. It's very, very important that you keep up to date with the government advice. And then once you've got that government advice, it's really, really important to follow that government advice. The reason for that is the government is actually trying to help you. That's the reality of it. So the question needs to be asked, are diabetics at higher risk? Well, at this stage, we're not 100% sure. You see, there is conflicting data from some of the studies, but we are now starting to see some statistics which give us a very good indication. Coronavirus patients over the age of 80 have a 15% chance of dying. So it is age-related, as we've heard. It's still very, very early in the process. It's early days and time will tell. But at the moment, we've got to rely on the best advice we've got. There is some research which we can now start to reference, which starts to give us an indicator. Now, this piece of research was from Wuhan, China, which was the COVID-19 ground zero. It was published on the 17th of March this year, 2020, in the Hospitalist. The title of this study is Treating COVID-19 in Patients with Diabetes. This is what they say. Patients with diabetes may be at extra risk for coronavirus, COVID-19 mortality, and doctors treating them need to keep up with the latest guidelines and expert advice. This is a situation which is still clarifying itself. Even the doctors are scrambling for more information, and as we learn more about this virus, we will get that information. Most health advisories about COVID-19 mention diabetes as one of the high-risk categories for the disease, likely because early data coming out of China, where the disease was first reported, indicated an elevated case fatality rate for COVID-19 patients who also had diabetes. In an article published in JAMA, Zhanyu Wu and Jennifer McGugan summarised the findings from a February report on 44,672 confirmed cases of the disease from the Chinese Centre of Disease Control and Prevention. The overall fatality rate, or the CFR as they called it, at that stage was 2.3%. That's 1,023 deaths of the 44,672 confirmed cases. The data indicated that the case fatality rate was elevated among COVID-19 patients with pre-existing comorbid conditions, specifically cardiovascular disease, 10.5%, diabetes, 7.3%, chronic respiratory disease, 6.3%, hypertension, 6%, and cancer, 5.6%. The data also showed an age-related trend in the CFR, with patients aged 80 years or older having a case fatality rate of 14.8%, and those aged 70 to 79 years a rate of 8%, while there was no fatal cases reported in patients aged under 9 years or younger. The question is, it appears that diabetics are at a higher risk, but why would they be at a higher risk? Published in Touch Endocrinology is a very interesting article, and I'd like to touch on some things in this article. Now, keep in mind, all these studies that you are seeing on the screen, they will be listed for you underneath this video, where you'll be able to click directly through to the study and have a read of it yourself. The COVID-19 infection is a double challenge for people with diabetes. Diabetes has been reported to be a risk factor for the severity of the disease. And at the same time, patients have to control glucose in a situation with a decreased and more variable food intake, which can be an issue for diabetics. Diabetes is a risk factor for hospitalisation and mortality of the COVID-19 infection. Diabetes was a comorbidity in 22% of 32 non-survivors in a study of 52 intensive care patients. That's quite high. In another study of 173 patients with severe disease, 16.2% had diabetes. And in a further study of 140 hospitalised patients, 12 had diabetes. So we can see that the people dying from COVID-19, a significant portion of those people actually have diabetes. When comparing intensive care and non-intensive care patients with COVID-19, there appears to be a twofold increase in the incidence of patients with intensive care having diabetes. Mortality seems to be about threefold higher in people with diabetes compared with the general mortality of COVID-19 in China. Now keep in mind that the situation in China might have been a little bit different because different healthcare systems, different approaches with treating type 2 diabetes, the amount of people being treated medically, etc., will probably vary between the different areas. The number of comorbidities is a predictor of mortality in COVID-19. In addition to diabetes, the other common comorbidities are hypertension in about 20% of cases, cardiovascular disease in about 16% of cases, and lung disease in around 6% of cases. Indeed, people with diabetes are a high-risk group for severe disease. Notably, diabetes was also a risk factor for severe disease and mortality in the previous SARS, MERS, Middle Eastern Respiratory Syndrome, coronavirus infections, and the severe influenza A H1N1 pandemic in 2009. It is a fact that people with diabetes are at an increased risk of infections, including influenza, and for related complications such as secondary bacterial pneumonia. Diabetes patients have impaired immune response to infection. Poor glycemic control impairs several aspects of the immune response to viral infection and also to the potential bacterial secondary infection in the lungs. It is likely that many of the patients with diabetes in China have been in poor metabolic control when affected by COVID-19. Many patients with type 2 diabetes are obese, and obesity is also a risk factor for severe infection. It was illustrated during the influenza A H1N1 epidemic in 2009 that the disease was more severe and had a longer duration in about twofold more patients with obesity who were then treated in intensive care units compared with the background population. Especially metabolic active abdominal obesity is associated with higher risk. The abnormal secretion TNF-alpha and interferon characterise a chronic low grade in abdominal obesity and may induce an impaired immune response. People with severe abdominal obesity also have mechanical respiratory problems with reduced ventilation of the basal lung sections, increasing the risk of pneumonia, as well as reduced oxygen saturation of the blood. Obese subjects also have an increased asthma risk, and those patients with obesity and asthma have more symptoms, more frequent and severe exacerbations, and reduced responses to several asthma medications. Lastly, late diabetic complications such as diabetic kidney disease and heart disease may complicate the situation for people with diabetes, making them frailer and further increasing the severity of COVID-19 disease and the need for care such as acute dialysis. Some findings indicate that COVID-19 could cause acute cardiac injury with heart failure, leading to the deterioration of circulation. This is a very interesting write-up which gives us a little bit of an insight as to why type 2 diabetics are at a higher risk. The next thing that we've got to think about is the treatment of diabetes during COVID-19. Poor glycemic control is a risk factor for serious infections and adverse outcomes. However, the reverse is also true, and the risk of infection, including pneumonia, can be reduced through good glycemic control. The problem is that infections cause loss of glycemic control, and treatment of hypoglycemia is difficult during intercurrent disease with fever, unstable food intake, and use of some drugs in patients with respiratory problems. To maintain optimal glycemic control requires more frequent blood glucose monitoring and continuous change in anti-diabetic treatment after the measured glucose levels. You see, for diabetics, your blood sugar numbers really do matter here. Really need to make sure that you have very good control of your blood sugar numbers. The most important thing is, if you are struggling with getting those numbers under control, make sure that you see your doctor. As I said, your numbers have to be well controlled. Once you've seen your doctor, please make sure that you follow your doctor's advice. There's no point in seeing the doctor and then not following his or her advice. Also, implement a lifestyle that will help you stabilise and normalise your blood sugar levels. Do things that you know will control your blood sugar numbers. Implement a lifestyle that will also boost your immune system. Your immune system is one of the things that can help you in this situation. And if your immune system is compromised, that's not going to help you in any way, shape or form. Boosting your immune system comes down to a few very simple things. For those of you who have undergone the Diabetic Health Clinic lifestyle program, you will know that whole foods make a very big difference. You see, whole foods supply your body with micronutrients. The micronutrients are the very thing that the immune system needs to help you. Now, if you want to boost your immune system further, there is a way of concentrating those micronutrients, and that is through juicing. By juicing, we're removing the insoluble fibre, which is the substance that goes in one end and comes out the other. But what it means is that we can concentrate a lot of micronutrients in a manageable meal, and if we're going to eat those amounts of vegetables or produce, we just couldn't do it. So juicing is definitely a great option, especially if you can have a juice for breakfast or even lunch, just to boost your intake of micronutrients. Also, it is very, very important to stay hydrated. Drink at least 8 to 12 glasses of really good quality water per day. Now, on top of all of that, exercise is very important. It's a very important part of your lifestyle, and it also helps boost your immune system. The problem is that currently now we have a situation where it's actually hard to exercise. I mean, beaches are being closed. However, all of us have got a private spot somewhere where we can exercise, whether it's in the backyard, in our own private pool out the back, maybe even in our home. We need to focus on keeping up the movement. The other thing that is hugely important is good quality sleep. It is through our sleep period that our immune system repairs certain parts of our body. When we get into that slow wave sleep, which happens just before REM sleep, that is where the immune system works the hardest through our 24-hour period. And if you are supplying your body with good quality food, lots of water, exercise, and then you are sleeping well and giving your body long periods of time to actually go into that slow wave sleep, it will repair things in your body. That's where the immune system does its work for us. We've also had a lot of questions about supplements. Now, we live in a society where we like to take a pill for an ill, and supplements sort of fall into that category. So the question is, what about supplements? Well, the reality is that some supplements may be helpful for you. The most important thing with supplements is, again, follow your doctor's advice. You should not be doing anything without your doctor's advice. When it comes to supplement, as it is with good quality food or whole foods or micronutrients, it is important to educate yourself on the value of certain supplements. One of the supplements that has come up, which is immune boosting and antiviral, is lactoferrin. And there's been a few interesting studies done in this area. We will post those studies for you under the video so you can click through and have a read of them. But I suggest that you actually explore these studies a little bit. This first study actually talks about the fact that lactoferrin boosts the immune system. And I won't go through the study because it's quite complicated, but I would suggest that you do have a read of it. See, lactoferrin is an immune boosting supplement, which is what we need right now, is to boost our immune system. It is also an antiviral supplement. And this particular study that you see here talks about how it is an antiviral supplement. Lactoferrin can be considered not only a primary defense factor against mucosal infections, but also a polyvalent regulator which interacts with viral infectious processes. Its antiviral activity demonstrated against both enveloped and naked viruses lies in the early phase of infection, thus preventing entry of the virus into the host cell. Interesting, right? Then we start to look at some other studies, and this particular one is interesting because it relates to lactoferrin and SARS. And SARS, by the way, is a very close relative to COVID-19 or coronavirus. It has been reported that lactoferrin participates in the host immune response against severe acute respiratory syndrome, coronavirus, SARS in this case, invasion by enhancing NK cell activity and stimulating neutrophil aggregation and adhesion. You see, this lactoferrin may actually be very helpful in blocking the virus from entering the cells in our body. And this is some of the information that this particular study gives. Again, there will be a link to this study below the video, so please have a look at it. So as you can see, supplements like lactoferrin may actually be helpful. I mean, time will tell at the end of the day, but these are some of the things that you could explore. Again, it is very, very important before you do anything to follow your doctor's advice and check for further information below this video. We will give you links where you can click through and explore things like lactoferrin. Folks, we've covered a little bit of ground here, and I hope that some of this is starting to make sense as to why type 2 diabetics are at a higher risk. Now, folks, what I thought we'd do is put together a really basic to-do list so that you, as a diabetic, have a simple list that you can follow. And if you follow that list and you explore these particular points, you'll put yourself in the best possible situation to deal with what we're faced with. The first thing is, like for everyone, make sure you follow government advice. Washing hands, the 1.5 metres distance between other people, social separation. These are all bits of advice which are very important. The travel advice that we're getting. All of this advice is actually put together by the government to try and stop the virus from spreading. And it's up to you to make sure that you contribute to helping not just yourself, but everyone around you. Secondly, as a diabetic, you need to be in touch with your doctor and you need to follow your doctor's advice. Now, again, the advice might start to change a little bit as we learn more and more about the virus, but it is incredibly important that you actually follow the advice that your doctor is giving you. Thirdly, focus on your lifestyle. Your lifestyle can put you in a position of strength. If you do the right things, as we've discussed, then what you're going to be doing is you're going to be giving your immune system the best possible chance of doing what it needs to do for you, and that's to keep you healthy. Additionally, educate yourself. Make sure you're reading things. You know, I started poking around some of the studies, and I've shared some of those with you. Now, it just takes a little bit of time to sit down and start having a read of some of the stuff that's out there and start to educate yourself, become knowledgeable. You have a disease, type 2 diabetes. Don't just rely on someone to tell you things. Start reading. Studies are a very good place to start, because they are done from a research point of view. They're far better than going to Facebook and reading some post that someone's posted up saying gargle antiseptic, that'll get rid of it. You know, stuff like that is not helpful to anybody. 5, if you have any symptoms, you must seek help immediately as a diabetic. So what are the symptoms that you should be watching for? Now, first of all, this one is not a symptom, but as a diabetic, you should almost treat it as a symptom. If you have poor sugar control, then you're putting yourself at a much higher risk. So please monitor your blood sugar numbers. Now, keep in mind, if you don't have strips, you will need to go to a doctor as a diabetic in Australia and get him or her to write up a request for you to get the discounted strips. Make sure you do that. Make sure you're monitoring your blood sugar numbers. Understand what they're doing. And if you don't have good control, again, see your doctor. Follow your doctor's advice. Implement the correct changes in your lifestyle to control the blood sugar numbers as best you can. So let's have a look at some of the symptoms. There are some symptoms which are very common for COVID-19. Fever, as is a cough, usually a dry cough. Those two are the most two common symptoms. There's a lot of misinformation. People have a runny nose and they think, oh, I've got COVID-19. The two most common symptoms is the high fever. That's why you see at airports people being measured for their temperature, their body temperature with the infrared thermometers. There are other public places where we see that happen. We've seen those pictures on TV. The coughing is also a very common thing. It's a dry cough. On top of those two very common symptoms, there are the sometimes symptoms. It's very important to understand that these are symptoms which don't occur all of the time and they're not necessarily common. Sore throat can sometimes occur. Shortness of breath, finding it hard to breathe. Fatigue sometimes occurs with COVID-19, as do headaches and as does a runny or a stuffy nose. Rarely, diarrhea can occur. So folks, if you look at these symptoms, you start to get a really clear picture. Fever, cough, they're the two most common ones. Now, if those two are associated with any of the others, I would be starting to ring the alarm bells. If I had a fever and a cough, I would probably be starting to ring the alarm bell as well. Now, if I had a bout of diarrhea without any of the other ones, I probably wouldn't worry about it too much. Here is a major misconception, and you see it out in the public. Someone sneezes and everybody turns around. Sneezing is not, I repeat, sneezing is not a symptom of COVID-19. Understanding these symptoms and being able to identify when you may need a test is very important, especially as a type 2 diabetic. If you have any symptoms, please do not delay. See your doctor immediately. Folks, I trust that this has been helpful for you. I know that when I looked at type 2 diabetes, we got this snippet of information saying if you're a type 2 diabetic, you're at greater risk. I trust that this little video has helped you understand why, as a type 2 diabetic, you really need to treat this very, very seriously. Last but not least, folks, please stay safe and stay healthy. We really do want to see you on the other side of this pandemic.